Coming up today, the joy of pregnancy brought down by a cancer diagnosis. Meet this mom of 4 who endured chemo while pregnant and later a bone marrow transplant. How her cancer team and delivery team worked side by side to bring both mom and baby through. Good morning, I'm Jessica Lovell, and welcome to the Morning Medical Update. There are very few things a mom simply can't handle, but as we know, cancer can be unrelenting. Whitney Mayer was 27 weeks pregnant when she received the devastating news that she had acute myeloid leukemia, cancer. She started chemo immediately and then soon after needed a bone marrow transplant. But for her, it was God's timing, a great medical team on her side, and one perfect brother who brought her through.
Hey, dude.
Hello.
Can you say hi?
Hi.
The bond is extra special between Whitney Mayer and her 6-year-old son, Titan.
What do you think? You're in your pajamas for pajama day, right? Yeah.
This supermom is tight with all 4 of her kids. She's a busy mom and hairstylist.
After I do all this, I'm gonna run over to the Heritage House and do a few people's hair there.
But business and life stopped back in 2018. While 27 weeks pregnant with Titan, Whitney went in for routine blood work.
They said, we're noticing things in your blood work that we think maybe you're anemic.
She wasn't anemic. Further testing revealed shocking news.
I got a phone call after the bone marrow biopsy that said I had acute myeloid leukemia.
AML, a rare blood cancer that typically affects older adults. Whitney was just 32.
I had 3 hours to be able to pack my bags, and you needed to pack them for 30 days.
Whitney started chemotherapy immediately here at the University of Kansas Cancer Center, where doctors are accustomed to caring for more complex patients. The medical teams rapidly responded, working together, including creating a small maternity unit on the cancer floor just in case Whitney went into labor.
It makes me choke up every time thinking of my doctors. Like, they got me through the hardest times in my life, and I never doubted them.
Even the moment when they told Whitney she would need to stay in the hospital longer because in order to survive, she would now need a bone marrow transplant.
I've never left my kids, and the thought of that was really hard. And so it was just a lot in the moment, but I knew I have a really strong faith, and I knew I was okay, it's gonna be okay.
While still on chemo, Whitney gave birth to Titan at 32 weeks, and then it was on to the next big thing, finding a donor match.
Can I help you?
Yes, is Shane here?
Yes, come on in.
Thanks.
But she's got a big family here in this small town, so she didn't need to go far.
Hey, brother. How's Titan?
Meet local elementary school principal Shane Neal.
Who always wants to figure out whether I'm Uncle Shane or whether I'm Mr. Neal here.
Neal.
One of Whitney's 17 siblings. Turns out Shane was a 100% match.
And when you grow up in that size family, you grow up just knowing each other and that you'd do anything for each other.
Becoming his little sister's bone marrow donor was an honor. And now, 6 years out from transplant, so far, so good.
Just seeing that process and knowing that she gets to be there for us and our family and how important our family is to us.
This whole thing just opened my eyes to how short life is and how lucky some of us are and some of us aren't. There you go.
And we are so glad to have Whitney here in studio with us. How are you?
Good.
What's it like to see your story right there in front of you?
Every time I see my story, I choke up,
Yeah.
It's truly a miracle.
Well, and when you see these guys right here, sandwiched in between these two guys, your doctors, Dr. Mark Parrish, Director of Maternal Fetal Medicine with the University of Kansas Health System. Good to have you.
Yes, good to be here.
And Dr. Abdul Rahim Yaqub, oncologist and hematologist with the University of Kansas Cancer Center. Dr. Yaqub, what's it like?
Yeah, thank you very much. It's wonderful to be back, and it's absolutely heartwarming to always hear the story and be reminded and just to spread the news and the success of the teamwork.
Dr. Parrish, just great to...
Yeah, absolutely. It is truly miraculous and wonderful to see, you 6 years later, healthy, doesn't look like you aged one day. Dr. Yaqub and I were saying how I wish that we could have done the same thing, so I don't know what your secret is, but it's even more of a blessing to see Titan and your story and just be reminded of all the blessings that fell into place along the way.
Yeah, and I know it's great to come in here on a Friday and have doctors who haven't seen you in 6 years say you basically aged backwards.
Yes, yeah, that's always a perk, right?
Always a good perk. But let's go back to 2018. So we're doing the math. Titan would be 6 years old. How's he doing?
He's striving. You would never guess. I actually joke that one day my dad, I had to remind him, like, hey, you can't say that. He used to say, he's like the perfect kid. Maybe every baby needs chemo. I'm like, Dad, you can't say that. Like, that's not okay. He's doing amazing. You would never guess. Yeah, striving in school. He has no delays. He graduated the NICU doctors here, the pediatricians, at age 1 instead of 2. Very blessed. Yeah.
All systems a go with Titan.
Yep.
Well, we know you look great.
Oh.
How are you feeling? How are you doing?
I am doing really good. You know, I have very little. I have GVHD, which is honestly sometimes a good thing because that means your body, when your cells try to come back, then your body fights off your old body and all of that.
Tell people what you just said.
So graft versus host disease.
Okay.
And that is like, so it causes inflammation and irritation in different parts of your body, typically where there's mucous membranes. I tend to struggle in my lungs a little bit. At one point I had some issues with girl problems. I also had, I have a little bit in one eye, very mild cases of gut GVHD, but all of that is doing great. It's not even like, I don't even feel like it's fair to talk about. I have a few inhalers like anybody that has asthma, right? So I feel like I'm very much striving, yes. Like.
So take us back. You're excited to welcome your 4th child. That's a really exciting time. How did you know something wasn't right, or did something feel not right?
You know, I work a lot of hours, a lot, and I'm a hairdresser, work 12-hour days. I had found out I was pregnant. I remember having to tell my mother-in-law really early because my little girl had broken her femur, and we had a X-ray to go to, and I was like, I gotta tell her I'm pregnant. And I remember driving home from the doctor that day, and I had to pull over, and I was like, God, I'm really tired. And I would tell every client, if you met me in that time, this 4th pregnancy is kind of kicking my booty. Like it's really hard on me. But I just chalked it up to I work a lot, I get up early in the morning, whatever. And then when I went in for my I think it was my 8-week appointment, they had noticed they thought I was anemic. And I would say I chalked that up to, okay, I'm having a boy because I was anemic with my first 2 boys. So I didn't think anything of it. I mean, I would say I was super fatigued during that time. But again, I think every symptom I had was anything that you would have when you're pregnant, you know,
Yeah.
Shortness of breath when I would work out, those type of things, but nothing, you know, out of the ordinary of pregnancy.
Yeah, and that's tough, Dr.
Yeah.
Parrish, because you know how many times you have all these, your body's just weird when you're having a baby, and so you're just, I would chalk everything up to the fact that I'm growing a tiny human inside my body,
Yeah,
and all these
absolutely.
weird things are happening. So that doesn't surprise me that she would be feeling, you know.
Yeah, not at all. I mean, a lot of those are just normal pregnancy-related symptoms, and we are guilty oftentimes of just saying, oh, it's because of the pregnancy, and just brush it off.
Yeah.
But you do these tests, and it comes back as acute myeloid leukemia. Dr. Yacoub, we've heard of leukemia. What makes acute myeloid leukemia different? What is AML?
Yeah, so thank you for the question. So leukemia is a word that means a cancer of the white blood cells. And there's so many of those leukemias. But the word acute myeloid leukemia is a very specific disease. It's one of the highest risk diagnoses. It's a diagnosis in which the immature cells of the bone marrow stop working, and the bone marrow stops making the effective blood elements and start making immature cells we call blasts. Acute myeloid leukemia without immediate therapy is extremely high risk in terms of affecting the well-being of the individual as well as the longevity. And it does require intensive multidisciplinary treatment that goes on for months, and hoping for a cure, because really the only way to live with acute leukemia is to live without it, to not have it and be cured with it.
So it's typically treated how?
So the treatment field has evolved significantly, and there isn't one size fits all treatment anymore. But for individuals who are young and fit, we give them the best and the most powerful treatment, some of the most complex and highly intense chemotherapy regimens in order to completely wipe out the cancer from the first go. And in some patients in which we have a concern for the disease coming back, we try to consolidate with even more therapies like a bone marrow transplantation. So the general approach is to start with an aggressive treatment, aggressive chemotherapy combination, which has evolved over the years. We have different combinations now, we have different drugs, and that field continues to evolve. And following that with another wave of consolidation of a different form of treatment.
But I bet your typical patient isn't a pregnant woman or in her young 30s. How did that change your approach when you met Ms. Whitney?
So absolutely not the typical patient. So that really is the unique situation with Whitney. And even her diagnosis was not straightforward. So we really didn't even get the diagnosis from the first biopsy. So we had to go through a second bone marrow biopsy to be able to confirm the diagnosis, because at the beginning there was a concern that this might be part of the pregnancy spectrum. But then after the second biopsy, we had an absolute confirmation that we got the right diagnosis. And then so many things go on through that. And then the phone call I made to Whitney on April 2018, I still remember very vividly. It is such a hard phone call to make. And I really had to run the phone call by some of my colleagues, even rehearse it before giving her the call, just to kind of bring her up to what she's going to be facing soon. So we don't have one patient, we have a mother and a child. So we have two human beings at risk. And we need to do the maximum protection for the mother and the baby. So we're treating two human beings at the same time.
I love
so
hearing
that is a much more complicated.
Well, and so much so you had to rehearse that phone call. You must have remembered that phone call quite well.
Yes, yeah. Just like, I mean, I could play it out to a T, everything about that day.
You never forget it. Mm-hmm. So Dr. Parrish, what was your approach to Whitney's care at the time? When were you brought into this case?
Shortly after the diagnosis. I think we were part of the diagnosis, if I remember correctly.
Yes.
Just had you in the hospital, and we were helping to co-manage as we were working through what the diagnosis was and what the treatment was going to look like. You know, ultimately, very devastating news, and not the type of news you want to get at all, but when you're pregnant, it just adds another layer of complexity to it for sure. Mm-hmm. Because, you know, when we're thinking of these rare situations where moms are diagnosed with a cancer or any medical condition that could also impact the baby as well, you know, we take into consideration, all right, how far along are you? And at that point, you were only 27 weeks. It was really pretty early still. So a lot of times it's easy if you're later in the pregnancy, we just bail and say, we're going to deliver the baby and then we'll treat mom. But at this point, there were a lot of risks to be taken into consideration for the impact on the baby, on the newborn risks to delivery. But we also had taken into consideration that chemotherapy is not benign. And it could absolutely, if it's going to potentially be wiping out the normal products in your bloodstream, it's also potentially going to impact that of the baby. So,
is that was my next question? Is it the obvious question of you're always telling? I'm sure your moms, your pregnant mothers, you know, put only good stuff in your body, only good healthy things, and chemo would not be top of the list.
Yeah. We have patients that are afraid to take vitamins or drink coffee, and then we're talking about putting this poison into your system.
I remember the nurse one time saying, I said, I want a sandwich, and she said, you can't have deli meat, but you can have chemo.
Yes.
And it's like hard to understand that.
Yeah, that it is. So maybe kind of help us understand how that's possible and the kind of the risk versus reward of all of that.
Yeah, you know, so we do take into consideration that there could be harm to the kiddo, but we felt at that point that even though we knew there could be harm, we thought that harm was low, and I'll talk about what that harm could have been. But we weighed that against the benefits of keeping you pregnant. Mm-hmm. You know, we knew the harms were if it's going to cause you to have severe anemia, to have your platelet count get knocked down, your white count get knocked down. We knew that those same potential risks could happen to the kiddo as well. Mm-hmm. And so there were specific things that we could do. We are certainly limited, but we have some cool technology that allows us to know that the well-being of the kiddo is good. You know, another thing that we have to take into consideration is there could be toxicity to the placenta. And so if that kiddo is not getting good oxygen and nutrients from the placenta, that's another factor that we have to take into consideration. So we monitored the kiddo Titan, your son, by doing twice daily, I think, what we call non-stress tests. That gives us a lot of information about how well kiddo and placenta are communicating with each other. But we also did once to twice weekly ultrasounds of the baby. We're able to assess for any degree of anemia in these kiddos by looking at blood flow patterns in the baby's brain. And fortunately, if I remember correctly, Whitney,
Yes.
you'd remember better than I would, but
Yeah.
we never saw any significant impact on him based on those parameters that we were watching
Yes,
for. So.
and if I remember correctly, was it Dr. Weiner that could do a blood transfusion in utero? And there's very few doctors that can do that, and it just happens to be ones at KU.
Yep. So at KU we can do those blood transfusions,
And that was
and
like a
that would have
risk,
been
correct?
yeah, and that would have been something that we would have taken into consideration. That if we saw severe anemia and you were still very early, we would have done a fetal blood transfusion in order to prolong the pregnancy or keep him in as long as we could. So.
And Dr. Yakub, what kind of conversations are you having with Dr. Parrish's team?
Yeah, so one thing to add is that the word acute means urgent, and the option of not doing something was not on the table. The option of doing something later was not on the table. It was really a disease that needed to be tackled immediately. She was already symptomatic. By the time she got to us, it's been going on for at least 3 weeks on record. So we really, dealing with the disease was immediate. And there was the risk to Whitney and the risk to the baby, but then the risk of doing nothing was not acceptable. So we are fortunate to have a wonderful acute leukemia team with multiple physicians at the University of Kansas. We work very closely together. We coordinate very closely. We discuss a lot of those cases together in a multidisciplinary way on our weekly meetings, and we really make collective decisions regarding how do we approach those patients. So it took really a team of acute leukemia doctors who initially helped with Whitney's health, deciding on the treatment, deciding on the coordination with the obstetric team, with the high-risk OB team in the hospital, and we had a reevaluation, very frequent reevaluation. Over that. And then early on, we also involved the other team, which is our bone marrow transplant team, which is the other partner in the story, in which how do we, as we are planning the induction part, the first life-saving step of chemotherapy, getting the cancer to remission, we're also planning ahead of how do we keep her in remission for the rest of her life. So a lot of that is very time sensitive. You start doing that from day one. So we had to, we had 3 partners in this process to try to get her taken care of, get the baby taken care of, and keep them both healthy for the rest of their lives.
A lot keeping you up at night, I have a feeling, during that time. And before we get to the bone marrow transplant, again, the next step in this case, but you created this kind of mobile delivery room in the cancer unit in the event that she were to go into labor during that time of chemo.
Yeah, so we had everything set up just like it would be in a labor and delivery suite. With the one exception is that we also had the neonatology team involved, just in case he did come early. So we had an isolette that they normally have babies in the NICU in your room. We had a C-section kit in the event that something really went wrong, and also had everything that we needed for a normal natural birth as well.
Ready to go.
Just at any point we could get there and intervene.
And every line of therapy is a commitment for a month. So when we started a therapy today, this is really, even the therapy ends in a week, it's just the effects of it is lasting for over a month. So really we had to, every step we make is a month of planning and coordination thereafter.
Ahead, right? Yeah. So she has Titan, that's great news, and then she needs this bone marrow transplant. Why did she end up needing that?
Hi, so Whitney actually did exceptionally well in terms of response to therapy. She went to remission with the induction, and we had excellent results in terms of our immediate ability to control the cancer and induce remission. Which is wonderful. However, remission does not equal cure. And unfortunately, patients with acute leukemia, even when we achieve remission, the risk of the disease returning, and when it returns, it's usually a lot more aggressive and it's harder to put back to remission. So our best bet of ensuring cure is to provide our best way to consolidate the cure, the remission, into cure. And we do have models to predict diseases in which what is the odds of the disease coming back. So some acute leukemia has standard risk or more favorable risk in which chemotherapy alone is adequate to cure the majority of patients, and those patients do not require necessarily consolidation with a bone marrow transplantation. But there is unfortunately, the majority of patients do not have that favorable risk, and they have a higher risk disease in which chemotherapy alone will not result in long-term remission. And that's when we weigh the risk and benefit. So if we have a good donor, if we have a patient who's fit enough to receive the therapy, and we have a disease that is high risk and likely to relapse, that is the perfect equation to deliver a curative bone marrow transplant therapy.
Whitney, where was your head when you heard that this is the next step?
I remember thinking I didn't think I would need it, because the whole time I just thought, no, there's no way, and so when they told me, I remember that was a moment for sure. And I remember that day my sister Brooke was with me and we cried a lot. And I was like, and Aaron, I believe Aaron was with me, and we were trying to navigate what that looked like. And again, time and realizing the moment of okay, so if I need that, I'm gone for 100 days. That's a whole different level of, so it was all of those things that were going through my head. Yeah. Which was a lot.
You have 4 kids. You do not have time for a bone marrow transplant.
Yes, that's how I
any
felt.
given day.
Mm-hmm. Yep.
Correct.
Absolutely.
And a newborn at that. So who's usually the best match, Dr. Yacoub, when it comes to her going in search for that bone marrow donor?
So ideally in our world, the best match is a full match sibling, and that would be in our books.
Okay.
In our books, that is the idea. Now, I am not a bone marrow transplanter, but we do have a wonderful team, and I think Dr. Abiyankar had been the champion on that team for Whitney. So it's really, again, it's a collective decision by a large team of physicians on. Sometimes we're not all lucky to have the best donors. We always look for the second best or the third best. But ideally, a full match sibling is the best gift your parents can give you.
Okay, and this is where the story gets interesting. If you missed the story off the top of the program, Whitney, you turned to your siblings. You found 2, not one, you found 2 full matches, and you found 2 half matches, which could have worked if need be, and some not ideal, but still. You have 17 siblings?
Yes. And crazy enough, they, typically they go for your brothers first because the proof of it not passing through the placenta, the blood when you're pregnant. And so if a woman has been pregnant, they would go for a full match brother before the sister, but then they would do either of those before an outsider. So they tested 4 of my 8 brothers. I have lost 2, and then I have a brother with Down syndrome and a brother that had testicular cancer, and so they didn't qualify. So out of my 4 matches, all of them had something that was, so genetics run deep, I guess.
They do. So tell us about Shane, the chosen one.
So it was Greg and Shane were the 100%. I remember sitting around and being like, okay, before we knew that it was boys or whatever, I was like, man, if I get this sister, I get her hair. Like, we were just making it like a fun, And when Shane was matched, it was, I felt like all of my siblings were jumping. Like, they would have done it in a heartbeat. It was almost like there was no questions. And so he's 7 years older than me. So he was the younger of the 2.
And changed his honeymoon plans, I heard?
Yes. So God bless him and his wife. When he was chosen, I remember saying, I understand, you're getting married on July 13th. I'm supposed to have this baby around June 25th. That could look, I don't know. They thought we could time it out, but will it time out? And he was like, and his wife Taryn were like, if we have to cancel the wedding and reschedule, they were willing to do anything. So they did have to reschedule and do a more makeshift honeymoon because my transplant was on July 25th and they got married on the 13th.
I think.
So yeah, God
they
bless
made a
them.
good choice.
Yes.
Yeah, I think that was not a problem
absolutely.
for them. Be sure to ask your questions. Use the chat on YouTube or Facebook. You can email the Medical News Network. The info is right there on your screen. Whitney, you had an entire family, ginormous family, a group of friends. They've been such a huge support to you during this time. Tell us about them.
I truly, I don't know what we would have done without every person that was involved. Every person, our community, my coworkers, my best friends, and of course our family. And then obviously the doctors were a godsend and became my friends as well. I feel like when you're in these moments of of the most devastating news and all these things, and you watch people just pick up every last thing to do whatever for you, and you all come together, it just makes you want to give back somehow.
And your faith played such a huge part. How so?
Yeah, so my faith, I'm one of 18. My mom's faith was bigger than anything you would have ever imagined. She passed away when she was 57, but what she instilled in us was like an unwavering faith. And if anything, I remember telling God, like, I'm giving you my hands. Like, it's not up to me. It's not up to, really, at the end of the day. The best advice I always think is, like, he allowed me a tunnel vision. And it was like I didn't allow my mind to go really there, even though I had to go there. Like, the doctors were, telling me all the things that could happen, but there was a lot of hope. And it's like God had a way of tunneling my vision to focus on hope. And I'm so grateful for just that. Yeah.
We know you are. Lots of gratitude
Yes.
coming from you. I know that. Dr. Yacoub, if someone does not have 17 brothers and sisters, they don't have a big pool to go to for those matches, how do they find a match? How do you go about doing that?
Yeah, so and that field has also evolved a lot recently, and there's been a lot of advances in the donor selection and the donor pool. So in addition to siblings, we also can take half a match from a sibling or a child or a parent. So that actually, with the ability to accept donors who are half a match that are related, that actually has almost guaranteed almost every patient who needs a donor probably could find a donor in that short family pool or small family pool of theirs. And then we count heavily on the National Bone Marrow Donor Program, in which healthy individuals volunteer to be on standby to be donors for random strangers whenever the need comes. So that has really been a life-saving line for so many patients. And 80% of patients that absolutely need a donor, through that pool, we might be able to help them. And the donor can be in the US, extra-US, can be anywhere in the country, of any age. It's just, it's wonderful to have that as a resource.
And it's a simple thing to do. You just swab the cheek. And that's why we love to educate on this and send people to bethematch.org. It was actually rebranded, so now it's called NMDP, the National Marrow Donor Program. You can find their website and learn more about getting that simple cheek swab kit sent right to your home, and you could potentially save someone's life anywhere in the world. So again, just go to either bethematch.org or nmdp.org. Dr. Parrish, Dr. Yacoub, you're both specialists, very different disciplines that you work within. How does working here at the health system make handling a case like Whitney's so much better, that you have each other on hand at any moment?
Yeah, it makes it easy. And I always tell people that are interviewing for jobs here or interviewing for training spots here that one of the biggest pros of being at the University of Kansas Health System is the fact that we have such great specialists, subspecialists in all areas, and it's amazing how great the communication is all the time, and collaborating to ensure, for us specifically in our field, healthy pregnancy outcomes. Having healthy mom and healthy baby is absolutely our ultimate goal. And in your case specifically, it was Dr. Yacoub, the bone marrow therapy transplant team, the neonatology team, all just came together to ensure that outcome. And it's a blessing to work here.
Yeah.
Dr. Yacoub.
Yeah, and it's absolutely wonderful to be in an environment where you have colleagues who are very much on the top of the cutting edge of the science and the absolute positive attitude to help. I know Whitney's story is near and dear to our hearts, but I call Mark probably every other week on a situation. We've had, we're blessed with wonderful colleagues in all disciplines, in which the level of care that you can provide is way above and beyond that can be provided anywhere else in the country. The diagnostics, the therapeutics, the coordination of care, and it's a much higher level than anywhere else and people aspire to be at this level.
I think the story that sums it all up is that moms naming their children after you. I think the last time you were on, we had a story very similar to Whitney's, and they actually named their son after you. So that's, I know, a big proud moment
biggest
for
badge
you.
of honor. Yes.
Dr. Parrish, have you had any children named after you?
Nope, not so lucky.
I know,
Yeah,
I'm
not
like
so
really
lucky. I know.
thinking I should have.
1-0.
All right.
Let's bring back Mark.
Work on this.
Let's
yeah.
bring back
Yeah.
Mark. I love that. Well, certainly well deserved. Okay, that's a career goal.
That
Have a
is,
child
yeah,
named
once
after
I
you.
get that, then I'll be like, all right,
I'm done. I am done. Let's get to some questions from our viewers this morning. And Jenny wants to know if they ever consider just taking the baby early. You mentioned that. Why wouldn't that be a go-to? I know 27 weeks is early, but
There are certain points in the pregnancy where delivering the kiddo too early would have resulted in a lot of risk to the baby, not only risks of death, but also risks for things like cerebral palsy, having spontaneous strokes, a lot of other lifelong, life-altering complications. And so we had to take that into consideration. In Whitney's case, what we did, and Dr. Yakub alluded to this as well, it is a month planning ahead each time that she had a treatment. And part of that thought process was we wanted ideally for Whitney's blood counts to return to as normal as possible, because going through either a vaginal delivery or a C-section, either one, is a tremendous amount of stress, puts not only the stress on your body, but increases risk for infections. And so our goal is to have Whitney as healthy as possible, and we wanted to have her as far along as possible as well. We were fortunate with the coordination of everything with Dr. Yakub's team to watch those counts closely, and we were able to time it out perfectly and delivered around 36 weeks. Is that right?
32.
30,
Yeah.
It was 32.
That was the goal.
Okay. We
And
got
then
to
he
32.
came, yes,
Okay.
spontaneously.
Okay,
But our
so-
goal was 36 weeks.
Okay.
Yes.
All right. That's
30.
right.
We'll take 32.
32.
Over
Yes.
27.
Better, much better.
Decision.
Five weeks. 5
Makes
weeks
a big difference.
Makes a huge difference.
Stu wants to know more about the fetal blood transfusions. First time hearing of these.
Yeah.
Where does that donor blood come from? Is it an adult?
Yeah, it's an adult. Yeah, and it's actually like any type of we use O negative blood typically. It goes through specific treatments to ensure that there are no viruses, just like any adult would get blood here, but there is it's specifically matched to know that it's not going to have any negative impact on the kiddo.
Dr. Yakub, a couple more quick questions. What's the likelihood that Whitney would ever need another bone marrow transplant, especially since she has that 100% match?
So we are 6 years out, and Whitney is in wonderful health. You know, I don't need a test to say that. So I think Whitney is far enough that we can be reassured that her disease might not be an issue in her future. So we're rooting for that.
Yes.
And last question, Whitney, Jennifer wants to know how you explain to your son his interesting entry into the world.
So funny. When he was little, we do talk about it a lot, actually, and he likes to tell his siblings that he's the one that saved my life, and that someday he's going to save lives. And it goes between a doctor, a chiropractor, a firefighter, a cop. He's went through all things of that, but he, yeah, it's very interesting. It's hard for him to understand. My hair never came back, so I feel like that part he remembers easy. I know that sounds crazy, but like so I feel like when I'm explaining it to him, he visualizes it, but then explaining it to other, I don't know, he's still so young, so you're trying to make it something that he understands. Yeah.
As time goes, that story will change.
Yes,
evolve.
as he evolves. Yes.
He probably
yes.
knows us, right?
Yes. Oh yeah. Tons of pictures. Yes.
I bet he knows.
Yes.
Dr. Yakub, what's the big takeaway from Whitney's story?
Yeah, I think it's wonderful that Whitney had a great outcome, and that took a lot of hard work from Whitney, a lot of dedication from her family and caregivers, and it took extraordinary amount of coordination, extraordinary amount of work by a lot of physicians. It took a whole team, and I can name many of the physicians who were involved over the years. But it's such a challenging and hard situation. That is the hardest phone call I've made in my life to a patient that day. Just the stake was so high, but the outcome was so wonderful. So it took a lot of soldiers to get that done, a lot of heroes to get that done. And it does take a system that incorporates all these heroes in one space to deliver the best care and the most compassionate care and to get the best outcomes. So I really advocate for patients, especially with acute leukemia. It's a disease that a handful of physicians are comfortable treating, and only a handful of centers should be treating. And the option of a bone marrow transplant for cure is discussed at diagnosis, so very early in the course. So not to start everything on the right foot, you really need to be in a center that has all these resources, the leukemia specialists and the bone marrow transplant specialists, and the ability of diagnostics that are cutting edge to be able to get the same outcome that Whitney had. Really, it takes a whole village to do that.
Yeah, thank you to you and your entire team for the work you do. Same with you, Dr. Parrish. What's the big takeaway from this story, this case?
Yeah, from this case, I couldn't have said it better than what Dr. Yacoub said. Just being in a center that allowed all these multiple disciplines to come together, to collaborate, and to ensure, not only did we have the most accurate diagnosis and the accurate treatment plan in place, but allowing for us to monitor Titan in utero and to ensure that he was doing well until the point that he came. And the fact that we were able to advance your pregnancy an additional 5 weeks made a tremendous difference in Titan's outcome for sure.
Yep.
So.
Good work. Good work.
Yes.
Whitney, what do you want people watching to take away from your story?
I think in life we are easily sidetracked. And I was looking and I was thinking of pictures, and I remember not being able to have human touch, And I remember one day my husband, you can't hold hands. You can't do anything. And I remember him putting a glove on to hold my hand. And you don't realize how much human touch and just your everything in life is so simple but means so much. And for me personally, I feel like sometimes we can get caught up in life and just, you get caught up in all the things that are going on. And at the end of the day, there's so much more to it. And those simple things actually in that state of mind meant so much to me that I did not realize until that moment. It's sometimes sad. I think we have to go through some of those things to make ourselves step back. Every time I talk about my story, it takes me back. It's easy. I've gotten caught back up in life. I do it. Everybody does it. Then I come here and it reiterates, okay, Whitney, put your stuff back in line because it's not worth, life's too short. I mean, more than anything, life is way too short. Are you waking up every day and truly thankful? Are you saying the things you need to say? One thing I want to get on is my kids. I remember my son, I missed his promotion. I just got diagnosed, and with that being said, I remember thinking, did I do all the things? Did I take the time? I was a workaholic. I definitely worked too much, and I've tried to find the balance in that. I feel more balanced. I try to really live to not take a day for granted. And I know this sounds, but appreciate your parents and what they do for you, and because that's why I am the person I am, is I have some really good parents that raised some really good kids, and they groomed us, and I have no doubt that, so, and give back, I really try to give credit where credit is due, and not for my own benefit, but for the greater good of other people. So
I cannot think of a better way to wrap up our week, a better message to go into the weekend with. Docs, yeah. I'm sure you agree.
Absolutely.
So thank you for sharing your story, sharing your family and Titan with us, and
congratulations on your wonderful health.
Thank you.
Come back and see us.
Absolutely.
We'll do another reunion.
Yeah, I would love that.
Thank you. Thanks to all of our guests. Thanks to our viewers for being with us. Have a great weekend. We'll see you back here on Monday. Coming up Monday on the Morning Medical Update. Lung cancer remains the leading cause of cancer-related deaths worldwide. It's also among the deadliest of cancers because it's caught late stage. I'm Jessica Lovell on the next Morning Medical Update. Learn if you qualify for a low-dose CT screening and how to get one. Monday at 8.
Subscribe to our Morning Medical Update and Open Mics with Dr. Stites podcast. Now, everywhere podcasts are available.